Welcome everyone. My name is Gary Weirs. I'm the Postgraduate Dean for North London. Welcome to this broadcast, and I would like to start by thanking you for your commitment and effort during what is proving to be a difficult time for all of us. All of us at HEE hope you're keeping well despite the uncertain and challenging circumstances that we find ourselves in. I would like to start off by just highlighting for any of you who are struggling or having a difficult time, we're here to offer you our support. Your supervisors, guardians of safe working, your peer group, your training programme directors are all part of the HEE community, and we're all here to support every single one of you when you need us, either for a listening ear or just a friendly chat. Please do reach out to your peer groups and support networks. I would like to talk first of all about recruitment, and first of all to wish my best wishes and good luck to all of you who are going through the challenges of recruitment. Most specialties have moved and are planning their Plan A and are progressing well, which I think is really encouraging news. We appreciate that situations have been less than ideal. We are trying our best despite the circumstances, and we are keen to ensure that we listen and hear feedback from you and learn as we go. HEE continues to work very closely and collaboratively with the Royal Colleges to make sure that we address and correct any issues as they arise within your specialty. Turning our attention now to rotations, we are aware that many of you remain currently redeployed. We hope as the NHS pressures begin to ease, so will redeployment. As always, redeployment is not an easy decision, and I want to assure you that every single redeployment decision has been made in conjunction with your postgraduate dean. If you have any concerns or discussions that you wish to have around your redeployment, then please do reach out and contact your educational supervisors and your training programme directors in the first instance. They have the ability and the knowledge of how to escalate those concerns that you raise to ensure that your postgraduate dean is cited and involved in those discussions. Turning our attention now to recovery of training, we would expect that each of you will have one-to-one conversations with your training programme directors to individualise your training programmes going forward in this post-COVID world. And that's especially important for those trainees who are at critical transition points and those trainees that are close to CCT. We ask that all of you, both trainees and trainers, to use any upcoming interim reviews as an opportunity to have these discussions in a developmental way so that we can begin to plan and understand your individual training needs. I think it's fair to say that we acknowledge that the post-COVID NHS will look very different to what we've been experiencing over the past 12 months. We'll be seeing increasing use of things such as remote consultations. There will be service delivery reconfigurations. I want to assure you that the postgraduate deans are absolutely integral and close to those conversations so that training remains at the heart of these discussions as trusts and primary care networks make their service recovery plans. We are also planning an ARCP webinar so that your concerns and queries can be addressed. As soon as we know the date, we'll let you know. In the meantime, though, please do raise any concerns about progression with either your trainee representatives, your educational supervisor, or your training programme director. So to sum up then, on behalf of HEE, I want to offer our thanks again for your compassion, hard work, and patience through these rough previous 12 months. As we start to see a light at the end of the tunnel, please remember we are here for you. We want to work with you to restart and recover your education and training, both in the short term and in the longer term as you proceed towards CCT. We're always keen to engage and hear from you, so please do not hesitate to get in touch or feedback through your usual local mechanisms. Your training programme directors, your educational supervisors, your directors of medical education all know how to feedback your concerns to the postgraduate deans. Or of course you can email or use the national communication challenges. Thank you once again for your time today, and I hope you enjoyed the broadcast.